Hello. Today we're going to talk about the difficulties in therapy and diagnostics of chronic Lyme disease, which has been shown to be a medical dilemma. First, we're going to start off with the prevention possibilities that the CDC declares. There is officially no prevention against Lyme disease. The only recommendation the CDC gives out is to protect generally against tick bites. Lyme disease is expected to be between 60,000 and 100,000 newly known infections per year only in Germany, which is up to 50 to 100 folds more than FSME. And FSME is the official tick disease, one of the tick-borne illnesses, and the only one where you have a vaccination against. So to come to the diagnostics and the main part of this presentation, diagnostics of Lyme disease shows to be very difficult. Lyme disease is primarily a clinical diagnosis, and even in that, it's a very hard diagnosis because Lyme disease has different stages, but we'll get to that later on. But the laboratory tests that we have right now are not good enough, not sufficient enough to have a standalone right, you know, the clinical diagnosis is a lot more severe and a lot more important than the laboratory tests are, because the laboratory tests are not good enough. But at least they can help manifest the clinical diagnosis of Lyme. To come to the 3 incubation periods and the 3 stages of Lyme disease, as I told you already, Lyme disease is divided in 3 stages. The acute state, which is from days to weeks after the tick bite, where you usually have the bullseye rash, the first symptoms of dermatological symptoms, the first maybe already joint pains, but joint pain and arthritis are usually part of the 2nd stage. And then we have the 3rd stage, which we call chronic Lyme disease or neuroborreliosis. Stage 1 is defined as a local infection, so directly at the puncture site where the tick bite was, the spirochetes penetrate the body. The red spot can be created, which creates this very known, very typical Lyme disease symptom of the bullseye rash. And this stage is also a very painless stage. The people do not have any kind of pain. And you know, everyone looks out for the bullseye rash, but the bullseye rash, and this is very important, and even a lot of doctors misinterpret this. It's not necessary to have the bullseye rash. The bullseye rash is not mandatory, and it is not always on the same body part where you have the tick bite. It's the bullseye rash can wander along your body, and it's even possible to have it on your scalp or on your nails or under your nails, and it can be as small as a penny or as big as a pancake. It is not a standardized size, not a standardized place where you expect this kind of rash. It can actually spread all the way along your body. So after stage 1, we directly shift into the second stage, which is the scattering of the pathogen. It wanders all around your body. We're now weeks, months into the infection. At first, some people experience nerve pain, some people experience first paresthesias. The lymph nodes will start swelling because your immune system starts to react to it. Some kind of paralysis. First, emotional disorders. You know, when emotional disorders start, we know how far we've already got. Psychological disorders are a very severe symptom because the pathogen already starts to interfere with your brain chemistry, and you know, actually the brain is the most protected, or should be the most protected part of our body, and if the pathogens are already in your brain and messing up your brain chemistry, we are already in a very difficult spot. Then some people already experience cardiac problems, you know, arrhythmias, tachycardia, bradycardia. So a very widespread set of symptoms. And then also, like I already mentioned in stage 1, you know, this is a smooth transition. The first people will experience joint pain, arthritis, the typical Lyme arthritis, as doctors call it. And you know, after this second stage, we come into very, very difficult and very problematic third stage, which is the late onset stage. The problem is stage 2 is often not recognized because stage 2 mimics, like, you know, also like stage 3. Stage 2 mimics a lot of different diseases. You know, if you have joint pains and untypical lymph node swelling, you know, people do not think of Lyme disease at first, especially if you did not develop the typical bullseye rash. And, you know, in stage 1 and 2, Lyme disease can still be successfully treated with antibiotics. And, you know, that's the only weapon conventional medicine has, is to treat it with antibiotics. And, you know, even if you come to our clinic, if you are in an acute state, and, you know, stage 1 and stage 2 are still an acute phase, we would treat you with antibiotics because in these 2 stages, antibiotics are still very successful. But after we come into the chronic state, so stage 3, antibiotics are not successful anymore, and then we have the difficulty. And the problem why stage 2 is often not recognized is the lack of sufficient laboratory testing, you know, of good lab results that are clearly showing, okay, this patient has Lyme disease or not. You know, when we are into stage 3, and stage 3 is are the patients that we have specialized on, or that are our specific patients. We have the late onset, the late manifestation of Lyme disease, which is months to years after the infection. You know, Lyme disease can be in a very latent phase, in a very unrecognized phase for 10 years or longer. You know, you will not develop any symptoms. You're a silent host, and about 10 years later, you develop your first symptoms, and then it hits hard. The problem is, a lot of the patients do not correlate the time of their tick bite 10 years ago, and now developing symptoms. So, and very important is the chronic inflammation, the inflammation that develops in your body. So the Lyme arthritis will spread throughout the whole body, from the knees to the elbow, fingers, toes, everywhere where you have joints. The skin starts to change, so we do not only have orthopedic problems, we already have dermatological problems and psychological problems. So inflammation of the brain, your mental state will decline. People are not able to concentrate anymore. Paralysis, so neurological symptoms will develop. So paresthesias, coordination issues, then brain fog, concentration issues. And these symptoms, everything that has to do with your nerves and with your brain, this is what we call as a clinical diagnosis the so-called neuroborreliosis. And the problem with laboratory testings, as I already told you, is that it has to be a clinical diagnosis first. So if we have clinical findings, your clinical picture shows, okay, there are a set of symptoms that could fit Lyme disease, and okay, 10 years ago you had a tick bite, then we would start with laboratory testing. And laboratory testing can be useful, but it has been shown that especially the unspecific markers, the unspecific immunological markers are the most important ones for the diagnosis and also the follow-up of Lyme disease, because it shows the load the disease puts on your immune system, and after therapy how your immune system regenerates. So the diagnosis and the therapy success must be clinically assessed, because there is no laboratory test that shows you a specific improvement of Lyme disease. It shows you an improvement of your general immunological or of your immune system and how it regenerates, but it does not show you that the strain that was left on your body, that it was made by Lyme disease. But as soon as we assess and target your Lyme disease, let's say the clinical picture, and you go out of the clinic, we would do a follow-up testing 6 months later, and your immune system regenerated. So that is the most important marker for us to show whether the therapy was a success or not. So another problem we have is that the tests we do for Lyme disease are just blood tests, serological tests. And we're looking in body fluids, especially blood here, or in tissues in which the spirochetes are not located anymore. Imagine this, that the spirochete comes into your body, and it's like a modern guy from Manhattan. You send it to the jungle 1,000 years ago. It does not know a thing. We're not the ideal host for them. We're, to be very direct, we're not suited for them at all. So the only thing they do is try to survive. And it's the same thing with the guy from Manhattan. He's in the jungle, and the only thing is he tries to survive. And there's a huge possibility that during that either he dies or the jungle dies, because these two these two things, they're not made for each other. They are like enemies, and like every life form out there, everyone just wants to survive, and that's what they do. They hide in our body as soon as possible. They hide out in our brain. You know, in our brain, we do not have an active immune system where they can be attacked. And so they look out for spots where our immune system is actually powerless against them. So, the interesting thing is, you know, the spirochetes, they are separated into 3 layers, but I don't want to get into that specifically. The thing I want to get into is that bacteria, so normal bacteria, usually divide every 20 minutes. So, and how do antibiotics work? You know, antibiotics, they're not toxins that directly attack the bacteria, but actually they are interfering with the reproduction cycle. So as soon as the bacteria starts to reproduce and starts to multiply itself, that's where the antibiotics come in. But the spirochetes, especially Borrelia burgdorferi, is very, very, let's say, resistant and hesitant to reproduce because we're not the ideal host. You know, imagine this, you are in a war zone, and it wouldn't be your first idea to start out and getting children. It's actually the last thing you would do. Only if you feel secure, you will start to reproduce. So, and that's the thing where spirochetes have or especially Borrelia has a great advantage, because they can stay in a latent, non-reproductive phase, which we call the persister form or L shape, for about a year and a half. And that is actually a very, very long time to be on antibiotic treatment. And also, they do not only hide intracellular, they're also, they do not only hide extracellular, but also intracellular. So you would need 2 different kind of antibiotics that work extracellular, so out of the body cells, and intracellular, so in your body cells, for a year and a half. But if you take antibiotics for that long, you have another problem, you know, and that is your microbiome being destroyed. So, and then also very important, the neurotoxins they produce, and this is something they do to stay alive. You know, they create this like this cocoon where they hide inside. These neurotoxins are so small and mainly extracellular, but they can penetrate all tissues and cell membranes because they are so small, and they start to destroy our own body. So this is the usual form of spirochetes. You know, these spirochetes, they look like this little corkscrew. But the problem is, as soon as they go into this latent form, they start to put their outer cell membrane inside their own cells, so our immune system cannot detect them anymore. How does our immune system create antibodies for them? They have to use the outer part with receptors on it to detect them. It's like their fingerprint to identify them. But they are very intelligent. They remove their face. They're not visible to our immune system anymore as soon as they are in this L shape. So let's get back to the blood tests. How do blood tests, so the blood tests that we have at the moment, how do they work? They work with antibodies. So imagine this. You have an active infection with Lyme disease, and your immune system detects them. Let's say you have 1,000 spirochetes in you and 999 of them are killed, and one of them hides in this L form. Your body creates antibodies against them, and your blood test will be positive because we test for antibodies. We do not test for the spirochete itself. So your body will eventually get rid of the antibodies over time, but the L form, the spirochete in the L form, is already hidden inside a nerve cell and will start reproducing after 1.5 years. So your lab test will already be negative because there are no antibodies anymore. Your body got rid of it because, you know, if all the antibodies would remain in your blood from every bacteria that has been in you over your lifetime, there wouldn't be much else than antibodies. So your body will get rid of the antibodies, and after, let's say, a year, 1.5, or even 10 years, they will get active again. They feel secure enough to reproduce. So they will start reproducing. They will get more and more children, but not in your bloodstream. They are already in your connective tissues. They are in your joints. They are in your brain, where they are safe because there is no immune system. There is no immune response that could threaten them immediately. You know, of course, your body will react to it, but it takes a longer time. So, and then they will start to produce biofilms. Biofilms is like bubble wrap and duct tape together, wrapping them in and protecting them against foreign attacks. So, but what does conventional medicine do now to treat chronic Lyme disease? The only thing conventional medicine has is long-term antibiotic therapy. And at first, this medication, these antibiotics, they bring relief. So the nerve pain will subside, the jittering will probably subside, maybe your paresthesias will get better, but it does not last. Antibiotics never catches all Borrelia in the late stages because some of them will always stay in this L shape. They will not reproduce. And like I said, antibiotics do only work in reproduction cycles. And after the discontinuation of the antibiotics, the reproduction of the spirochetes resumes until the body reacts again with symptoms, because the symptoms are already always a reaction of your body towards the pathogens. And the result of frequent antibiotic therapy is the emergence of resistance at first, and also the appearance of a leaky gut. Leaky gut is a state where your microbiome in your gut, where your gut bacteria shows lacks, and the mucosa, so the thin layer in your gut, is now permeable for heavy metals, toxins, etc. So you do not have a protection anymore against other pathogens or toxins. So, and now, here at Clinic St. George, how have we solved the dilemma of the laboratory tests and the clinical symptoms? So, as I already told, Lyme disease is primarily a clinical diagnosis. You have different kind of test sets, and especially the Borscano score. The Borscano score is a test of 50 questions, which our patients have to fill out before, during, and after therapy. So we see how they improved. This is a clinical test score. Then the next thing we did is the so-called visual contrast sensitivity test, which is an eye test to show how good your eyes respond to contrast. And we have seen that the neurotoxins attack the retina, and already in early stages of Lyme disease, your ability to differ between different shades of gray and different shades of contrast differences declines. So a patient will probably have a lower contrast sensitivity before the treatment, and it will increase afterwards. Then, as I told, we will do an immunological follow-up. So we will do a test as soon as they come in, before we treat them and after we treat them. We would do the inflammation checks, so with TNF-alpha, IL-6, NF-kappa-B, etc. And we will do non-specific laboratory parameters, which consist of the so-called LTT, CD56, 57 cells, so your unspecific immune system. And this is something, like I said already, that is very important to us, because with that we can show what strain the disease puts on your immune system and how much relief we have after the therapy. Also, we use dark field microscopy to assess whether or not there are living spirochetes in your blood. And from all these diagnostical sets, we can form a manifested diagnosis and a therapy indication. Thank you very much for your patience and for you attending our video, and see you next time.